Dear colleagues, we shall continue with the bones of the upper limb. I will show you today 2 bones of the forearm, radius and ulna, and 27 bones of the hand. The hand consists of wrist or carpus, hand proper or metacarpus, and digits. The bony structure of the forearm consists of the radius and ulna. The radius and ulna are bound together by a tough fibrous sheet known as the interosseous membrane. The radius is the lateral bone of the forearm, and it is the typical long bone and consists of 3 parts: upper end, shaft, and lower end. The long shaft extends between the upper and lower ends and presents a lateral convexity. It widens rapidly towards the distal end and is concave anteriorly in its distal part. The shaft has 3 surfaces: anterior, posterior, and lateral, and 3 borders: anterior, posterior, and medial or interosseous. The medial or interosseous border is the sharpest border. Anterior surface is concave and lies between anterior and interosseous borders. Posterior surface lies between the interosseous and posterior borders. Lateral surface lies between anterior and posterior borders. Pronator teres is inserted on the rough area, tuberositas pronatoria, in the most convex middle part of this surface. The upper end presents head, neck, and radial tuberosity. The head is disc-shaped and articulates above with the capitulum of humerus. The neck is constricted part below the head. The radial tuberosity is just below the medial part of the neck. Head is shaped like a disc, and in living it is covered with an articular hyaline cartilage. Articular fovea articulate superiorly with capitulum to form humeroradial articulation. The circumference of head is smooth and articulates medially with the radial notch of ulna. Neck is constricted part just below the head and is embraced by the lower part of annular ligament. The quadrate ligament is attached to the medial side of the neck. On the radial tuberosity, biceps tender is inserted to its rough posterior part. The lower end is the widest part of the bone and has 5 surfaces. The anterior surface presents a thick ridge which provides attachment to palmar radiocarpal ligament or wrist joint. The posterior surface presents the dorsal tubercle of Lister lateral to the groove for the tendon of extensor pollicis longus. It also presents grooves for the other extensor tendons. The medial surface presents the ulnar notch for articulation with the head of ulna. The lateral surface projects downward as the styloid process. The inferior or distal surface presents a lateral triangular area for articulation with the scaphoid and a medial quadrangular area for articulation with the lateral part of the lunate. The side of the radius can be determined by keeping the bone vertically in such a way that the narrow disc-shaped end, head, is directed upwards. The sharpest border, interosseous border, of the shaft is kept medially. The styloid process at the lower end is directed laterally, and prominent tubercle, Lister's tubercle, at the lower end faces dorsally. The convexity of the shaft faces laterally, and concave anterior surface of the shaft faces anteriorly. Fracture of the distal end of the radius is a common fracture in adults and occurs more frequently in the women because their bones are more commonly weakened by osteoporosis. A complete transverse fracture of the distal 2 cm of the radius, called a Colles fracture, is the most common fracture of the forearm. The distal fragment is displaced posteriorly and is often broken into pieces. The fracture results from forced extension of the hand, usually as the result of trying to ease a fall by outstretching the upper limb. In the anatomic position, the ulna is the medial bone of the forearm. The ulna is a long bone and consists of three parts: upper end, shaft, and lower end. The long shaft extends between the upper and lower ends. It has three borders: anterior, posterior, and lateral or interosseous, and three surfaces: anterior, medial, and posterior. Anterior, posterior, and interosseous borders separate anterior, posterior, and medial surfaces. The lateral border or interosseous border is sharp, crest-like. Anterior surface lies between anterior and interosseous borders. On the upper end of anterior surface we have ulnar tuberosity for the brachialis muscle attachment. Posterior surface lies between the interosseous and posterior borders. Medial surface lies between anterior and posterior borders. The upper end of ulna has two processes, coronoid and olecranon, and two notches, trochlear and radial. Olecranon process projects upwards from the upper end and bends forward at its summit like a beak. It has four surfaces: superior, anterior, medial, and posterior. Articulates with the humerus, with trochlea and the olecranon fossa. Coronoid process is projection from the front of the upper end of the ulna below the olecranon process. It has four surfaces: superior, anterior, medial, and lateral. Articulates with the trochlea and the coronoid fossa of the humerus. Trochlear notch is a large notch on the proximal end of the ulna that is formed by the olecranon and coronoid processes. It articulates with the trochlea on the humerus. Its superior, medial, and anterior margins provide attachment to capsule of the elbow joint. Radial notch articulates with the head of the radius to form the superior radio-ulnar joint. The lower end of ulna consists of head and styloid process. Head presents a convex articular surface on its lateral side for articulation with the ulnar notch of radius to form the inferior radio-ulnar joint. Its inferior surface is smooth and separated from ridge joint by an articular disc of inferior radio-ulnar joint. Ulnar styloid process projects downwards from the posterior medial aspect of the head of ulna. The side of ulna can be determined by keeping the bone vertically in such a way that the broad hook-like end is directed upwards, the sharp crest-like interosseous border of the shaft is directed laterally, and the concavity of the hook-like upper end and the coronoid process are facing forwards. Olecranon fracture is fairly common and often occurs following a fall or direct trauma to the elbow. In an olecranon fracture, the bone can crack just slightly or break into many pieces. The broken pieces of bone may line up straight or may be far out of place. On the hand, we can describe anterior and posterior surfaces and medial and lateral borders. The hand or manus is a composite structure consisting of 27 bones. The proximal end of the hand is the carpus or wrist. The carpal bones are 8 in number and are arranged in two rows of 4, a proximal row and a distal row. Distal to the carpus are the 5 digital rays. Each digit, called a finger, of which there are 4, consist of a metacarpal bone and 3 phalanges. The remaining digit, the thumb or pollex, has a metatarsal bone and only 2 phalanges. The carpus consists of 8 short bones, which are arranged in 2 rows, proximal and distal. Each row consists of 4 bones. The proximal row of carpal bones consists of the following bones from lateral to medial side: scaphoid, lunate, triquetral, and pisiform. The distal row of carpal bones consists of the following bones from lateral to medial side: trapezium, trapezoid, capitate, and hamate bone. The 2 largest bones of the proximal row, the scaphoid and the lunate, articulate with the distal end of the radius. The row of distal bones form the skeletal foundation for the fingers and articulate with the metacarpal bones of the fingers and thumb. The anterior surface of the carpal bones forms the floor of the carpal tunnel that supports the major digital flexor tendons that enter the hand. The metacarpus consists of 5 metacarpal bones. They are conventionally numbered 1 to 5 from lateral to medial side. Each metacarpal is a long bone and consists of 3 parts: head, shaft, and base. The head is at the distal end and rounded. The shaft extends between head and base. It is concave on palmar aspect and on sides. The base is proximal end and expanded. There are 14 phalanges in each hand, 2 in thumb and 3 in each finger. Each phalanx is a long bone and has 3 parts: base or proximal end, head or distal end, and shaft, which extending between 2 ends. The base of proximal phalanges have concave oval facet for articulation with the heads of metacarpals. The bases of middle and distal phalanges possess pulley-shaped articular surfaces. The shaft tapers towards the head. The dorsal surface is convex from side to side. The palmar surface is flat from side to side, but gently concave in the long axis. The heads of proximal and middle phalanges are pulley-shaped. The heads of distal phalanges is non-articular and has rough horseshoe-shaped tuberosity. The name of fingers are pollex, index, digitus medius, digitus annularis, and digitus minimus. You will easily recognize concave palmar surface and convex dorsal surface of the hand. You can see here the scaphoid fracture and the 5th metacarpal fracture. If a bone is broken and we allow the muscle to continue acting on it, the muscles can pull the broken bone fragments apart and the bone will not heal, or we heal in a position of deformity. Dear colleagues, if you have any kind of questions and suggestions, you can send me email.